And welcome back to the Steve Malzberg Show. And ladies and gentlemen, a bombshell yesterday, an attempted distortion by the media and the Democrats, and then testimony today which confirms the bombshell. And joining us now to talk about all this is Congressman Joe Pitts, Republican from the great state of Pennsylvania. He happens to be chairman of the Subcommittee on Health for the House Energy and Commerce Committee. Congressman, welcome, sir.
Thank you. Pleasure to be with you.
Well, thank you for taking the time. Okay, so yesterday we get word that the nonpartisan CBO issued a report saying that Obamacare will cut work hours by the equivalent of 2 million jobs by the year 2017, which, by the way, you need to remind people that's just 3 years from now. And then the spin started, and the White House and the Democrats and the media said, oh, no. This gives people choices. That's not what this means. No. And then today we had testimony from the CBO director, Douglas Elmendorf, who said, no. Obamacare creates a disincentive to work. It meant what it said. It said what it means, and this is a big blow to the Democrats.
Yeah, absolutely. It is devastating to Obamacare. By the year 2024, 2.5 million fewer people with jobs as a direct result of the law, and it shows the deficit increasing by $1 trillion because of the new entitlement programs, so it puts the lie, shows how false what the claims were by the administration that Obamacare is good for the economy, good for government finances. Well, it's just
in around 2017, but you're correct in your years and your numbers, obviously. I mean, have your health care, and I guess you could have your food stamps, and you could have your welfare, and we'll just create a government.
Clearly would trap Americans in low-wage jobs, making it too expensive to move off of Medicaid. It traps people in poverty. The president says he wants to attack income inequality, but his health care law will contribute to the problem over the next decade. Speaker Pelosi said that Obamacare would create 400,000 jobs almost immediately and 4 million jobs over time. That, just absurd. And CBO now shows that the opposite is true.
We're talking to Congressman Joe Pitts here on the Steve Malzberg Show. I want you to hear Nancy Pelosi with Jon Stewart on his show the other day, and he asked her a question about the website and the Obamacare. The premise was, liberals like to do things with big government, but why can't they get anything right? And then he was talking about the website. Here's cut 11. Let's give a listen.
But I mean, aside from that aspect, I meant more in terms of okay, we are going to set up a healthcare website that is an exchange. People are going to come to it.
Right.
Why is it so hard to get a company to execute that competently?
I don't know. And as one who works very hard. No, and that's my question.
Well, let me get the House. What do you mean you don't know?
Well,
how do you not know?
Well, it's not my responsibility. But
it's not my response. He was laughing at that answer, and then she says it's not my responsibility.
Yeah, it's really very, very pathetic, and we want the economy to improve. We want people to be able to head towards solvency of the Social Security and Medicare program. Just the opposite is happening. Fewer workers working fewer hours is devastating to the finances of programs like Medicare and Social Security and to our economy. It's just pathetic. And that shows why this law must be repealed and replaced.
Well, Congressman, let me also ask you, and I think the Republicans are missing a great opportunity. It's unfortunate, and I don't always appreciate the tactics of Obama and the Democrats bringing forth victims or people that they say are victims of bad policy, but I mean, $4,000 for a woman with 2 kids for a deductible in addition to the premiums going up. It's insane. People can't afford this. So here's another thing. I think really that you guys got to hit home with this, that people cannot afford this.
Yeah, absolutely. It's destroying jobs. It's destroying people's lives. And, a lot of people are coming in saying they've been now put on part-time work because then they don't have to provide health care to their employees who are part-time. So they lose not only their benefit of health insurance, they're losing wages. So now they're trying to get another part-time job just to survive. There are a lot of people in just survival mode. And I think these are the people we need to, along with the ones you said, start putting on the media every day.
One more question for you, Congressman. You've been generous with your time. Is it still accurate to think and believe that this year, especially towards the end of the year, we're going to have 85 to 100 million people get notification, as 6 million got last year, that they're no longer going to be covered under their employer's health plan?
Well, yes. The point you're making is something the CBO report didn't include, and that's the impact of Obamacare's employer mandate, which means businesses with 50 or more, full-time employees have to provide health insurance or pay a $2,000 fine, a penalty, and so a lot of those employer plans are going to be canceled. You're going to have millions and millions of people losing their health care coverage from employers. That this thing's a rolling disaster, and it's going to just continue to hurt our economy.
Yeah, no doubt about that. Congressman Joe Pitts, who is the chairman of the Subcommittee on Health for the House Energy and Commerce Committee. Thank you so much, sir. Appreciate your time.
Yes, sir.
Thank you. Okay, well, folks, it is a nightmare. And with all due respect to the congressman, and I appreciate that he likes my suggestions, and this is no critique of him, but it is a critique of leadership. Again. It's a critique of the RNC. Again. Because, I sit here and I make these suggestions to every guest we have, every Republican guest, anybody who I think might be in a position to implement this or interested in hearing about it, and they all love my ideas. And I don't see how they're placating me. They have no reason to. And I don't think these ideas are bad ideas. But where are they? What are the Republicans talking about today? I don't know. Haven't heard them talk about anything today. But they should have people. I see printed stories in front of me. Like I said, Los Angeles Times. Once Obamacare customers navigate the confusing websites and pay the often high premiums, they find that many doctors do not accept Obamacare insurance policies. Tells the story of a cancer patient who was turned away at the oncologist's office and was only seen by a doctor once state regulators came to her rescue. This story is not unique. It says here it's the story millions of Americans will and or are facing right now. So you get some of these people and you force the media to listen. You force the media to report on it because every day you tell a different story, 10 different stories of these poor people. And you know what? Soon it's going to be all of us because the employer mandate got a year's delay as Obama broke the law and the Constitution by implementing a delay in his own law. He had no right to do that. And he gave employers a year before they had to decide whether or not they'll dump their policies and put everyone in Obamacare. And that's what's coming. All right, folks, we're coming back also on the Steve Malzberg Show. We're going to take a look at MSNBC up close on the Steve Malzberg Show, Newsmax TV and radio.